Hello and welcome to my poster presentation on an economic analysis of post-radiotherapy imaging for squamous cell carcinoma of the oropharynx. My name is William Zelenczuk and I've just completed my first year at Laurentian University in Sudbury, Ontario. I want to start off by saying that I have no relationships with for-profit or not-for-profit organizations, and this session has not received financial or in-kind support. A standard treatment for squamous cell carcinoma of the oropharynx involves external beam radiation with the potential addition of chemotherapy. This is then followed by imaging and examinations to assess for residing disease. In Ontario, a positron emission tomography scan, which will further be identified as a PET scan, is only funded if a 3-month post-therapy computed tomography scan, which we will further refer to as a CT scan, identifies a residual abnormality. With this, the healthcare system has to pay for both a CT scan and a PET scan, which further leads to increased costs and radiation exposure for the subset of patients who are receiving both scans. We undertook an economic analysis to determine if the current paradigm effectively minimizes costs, or if it would be more beneficial to follow all patients to have a 3-month PET scan, with disregarding the CT scan altogether. In this analysis, we included all of the patients who were treated for squamous cell carcinoma of the oropharynx within our cancer center between the years of 2019 and 2023. With this retrospective chart review, our goal was to identify how many patients received PET scans compared to CT scans after their treatment, the cost of the scans altogether, and the number of surgeries done with the PET scan that resulted in residing disease compared to those without a PET scan. The costs of both scans were determined by combining our institutional data for the average cost of the organization in order for them to perform the scan, combined with the appropriate Ontario Health Insurance Plan costs to compensate a radiologist to interpret the scan. In total, we had 67 patients within this study. 98% of these patients received a pre-treatment CT scan, while 80% of the patients received a pre-treatment PET scan. After the patients received their therapy, 91% of the patients received a standard follow-up CT scan, and 45% of patients underwent a PET scan. The cost of a CT scan totaled to be $213, and a similar process was conducted for the PET scans, which resulted in a substantial amount of $1,755. It is important to note that just 10% of our patients underwent no post-treatment imaging. In the current state, the total cost for one individual patient cost $996. In our proposed future state, it would cost $1,755. After therapy, 18% of the patients underwent a salvage neck dissection. Half of them had, and half of them did not have, a post-therapy PET scan. Residing disease was present in 33% of the patients that had a post-treatment PET scan, and only 17% in those who did not. The decision regarding the funding of the PET scans are driven by both cost projections and evidence of proven clinical efficacy. For the patients who fall within the requirements for this study, PET scanning has proven efficacy at detecting residual disease. However, with the current standard, 45% of the patients are subjected to 2 consecutive scans, while 55% of the patients only receive a post-therapy CT scan. If patients only received a PET scan like we proposed, it would actually increase the cost despite the fact that 45% of these patients would receive 2 scans when 1 would suffice. The current way that the post-radiotherapy PET scans are funded in Ontario delivers the care at a lower cost to the healthcare system compared to our theoretical system that allows all patients to receive a post-therapy PET scan. Our system, where all patients receive a PET scan post-curative intent radiotherapy for oropharyngeal cancer, could be indicated based on clinical outcomes, but it is actually not supported on economic factors in Ontario, as found by our analysis. It is important to mention that this study did not evaluate the accuracy of each imaging modality or the downstream costs to the system or the patient due to false negative scans. This would be an interesting topic for future studies. Thank you for watching my presentation.